Good morning, everybody. It's Dr. Tess Crawley here, Director of Dr. Tess Crawley and Associates, psychology practice based in Hobart and Launceston, with rural outreach to quite a large section of Tasmania. So all along the east coast, we have clinicians from St Helens all the way down to Triabunna, and we have clinicians who go out to Georgetown and Scottsdale. And for everybody else in between, of course, we're also available via, I say Skype, but we actually prefer to use Zoom, which is a nice secure platform online. Now, today is day 20 something, I've forgotten already, of my 90-day vlog challenge, and it is also Are You OK Day. And I've done a couple of videos this week talking about suicide prevention and awareness, talking about stigma and not letting stigma stop you from asking for help or stop you from offering help. So today I wanted to talk about the sentiments behind Are You OK Day. Now, a lot of people say, shouldn't every day be Are You OK Day? And of course it should. Absolutely it should. The purpose of Are You OK Day, though, is to raise awareness of this issue around asking people if they're okay. So we don't only do it on Are You OK Day, but this day gives us the opportunity to reflect how we might check in with friends and family when we're concerned about them. So think about somebody you know really well, and they're not quite themselves. They're withdrawing from social activities. They're staying home a bit more often than they would normally. They've lost their spark, and they just seem to be not their normal selves. Now, somebody doesn't need to be, at obvious risk of suicide for you to ask if they're okay. If someone's got a cold, you wouldn't have any concerns whatsoever about asking if they were okay and was there anything you could do to help them. So when it comes to mental health, we sometimes feel that it's not our place, that it's an invasion of privacy perhaps, or we're afraid of embarrassing the person, but it's quite okay to ask someone if they're okay. So the way we can do that, first of all, is to just acknowledge what we've noticed. You don't seem yourself. Are you okay? That's not a hard question to ask somebody. And what we often find is people are actually quite relieved that somebody's actually asked them the question. Not that they're necessarily consciously waiting for someone to ask them, but perhaps they didn't realise themselves that they were struggling until someone else has noticed and said, hey, I'm a bit concerned. Are you okay? Is there anything I can do to help? So once you've asked the question, the next step really is to listen to what the person's saying. Now, if a person says to you, yeah, I'm fine, and brushes you off, and that doesn't sit well with your gut feeling about what's going on, you can still ask again. You can say, you know what, well, I've noticed, I'm hearing that you're saying you're okay, but I've really noticed that you've not been your normal self, and it's, I'm a little bit worried about that. Is there anything I can do, or is there anyone I can contact who can support you? And again, the sky doesn't fall in when you follow that up a little bit further or ask a little bit of a more detailed question, and that's okay. When the person starts opening up to you, don't try and solve their problems, and certainly don't be saying things like, oh yeah, I know, well then guess what happened to me the other day. Just try, hi Nalif, thanks for joining me today. Just try to sit on your hands and listen. Bite your tongue. Just listen. Just be there listening. And the best way to listen to somebody is to be making eye contact and nodding along with them while they're talking and just being present with them. Don't worry about what you're meant to be saying. Don't worry about what you're meant to be doing. All you need to do is listen. When the person stops talking, you can be saying, is there anything I can do to help? So ask them. And sometimes you will often find that people will say, you know what, there's nothing you can do to fix this for me, but thank you for listening. That's been a real help. When people are under the weather emotionally and they're stuck in their own heads, stuck in here, alone with their own thoughts, it's a little bit like, when you've been worried about something and you wake up in the middle of the night and you're worrying about it, but then when you wake up the next morning, that worry doesn't seem as big. Everything seems worse in the middle of the night. Have you noticed that? It's a little bit the same when we're stuck with our own feelings and our own emotions inside our head. the act of talking them out aloud, for a lot of people, that's enough. Like, that can be all they needed to sort through what they're feeling, is to be able to get those thoughts out into the open and hear themselves saying those things out loud. That, for many, many people, is a huge pressure release. So by asking someone if they're okay and listening to them talking, you've already done an amazing thing that they might not have even known that or realised that they needed. So if they then say, you know what, I think I really need some help, I actually am feeling suicidal, I'm worried, don't panic. It's the first thing. Don't run from the room screaming. Say, okay, I can hear that you're feeling really like this has gotten on top of you. Who can I call? Is there someone I can call to come and support you? Or is there something we can do together that's going to help you feel better? Like perhaps go to the GP or even go to the hospital emergency department. So if somebody tells you that they're feeling suicidal, don't brush it away. Don't be frightened of that thought. It's okay to ask them, what can we do to make you safe? Okay? What can we do to keep you safe? I'd really like to know that you're supported through this obviously difficult time. So what can we do to keep you safe? And then asking whether a GP or a family member or a partner or another friend. So if you're a workmate, sometimes that's a tricky position to be in when you're a work colleague and not necessarily the closest social contact that that person has. But being a workmate might mean that you're kind of a safe person to talk to as well, because you're not necessarily emotionally involved. So don't be afraid to encourage the person to take some kind of supportive action. So their GP, hospital, partner, somebody else, lifeline. Looking at the Beyond Blue website together can be helpful. You can help them, find the phone number for them to call to talk to somebody as well. Okay, then after all of that, the next step is just touching base again. So maybe the next time you see them, or if they haven't come into work or you haven't seen them for a few days, just ringing and seeing how they're going. And again, just checking in on you. We had a great chat the other day, and obviously you had some big things on your mind, so I just thought I'd touch base and see how you're travelling. Again, it doesn't need to be difficult, it doesn't need to be awkward. Your anxiety about asking those questions, that's something for you to tuck away in the back of your mind, and to just try and push through your own anxieties and keep in the forefront of your mind the concerns that you've got, the gut feelings that you've got about this person not being quite right, and overriding your own anxieties and just saying, I'm just going to ask, are you okay? You can tell me to nick off if you want to, but I just want to check up on your body, see how you're going. Okay, so we've talked a little bit before about stigma, and stigma stops people from seeking help because they don't want to be seen a certain way, they don't want to be judged harshly. Stigma stops people from offering help because they don't want to be seen as interfering, they don't want to be seen as being alarmist. So put all those overthinking, chattering monkeys aside, and make sure that you're feeling okay with asking if you're okay. It's also okay for you to get some support yourself. If you've asked someone that if they're okay and that person has ended up not being okay, you can get your own support after that conversation. So talk to a friend and debrief, keeping the confidentiality in your mind if you can, but seek support from somebody, even you ringing Beyond Blue's phone number and having a chat to them that you've just had a tricky conversation with someone who was suicidal, and you're not a professional, you don't know how to handle it, you think you did okay by getting them to their GP, but you just need to get it off your chest. That's a perfectly valid use of the Beyond Blue support line. Lifeline, all those support numbers. If you're dealing with any of this stuff, you're allowed to use those numbers to back you up too, to get things off your mind. And that's probably the best way, I guess, if it's a really tricky, confidential conversation that you've had, to maintain that confidentiality, is to ring one of those support numbers for yourself as well. So that's it for Are You OK Day today. Keeping in mind that every day can be Are You OK Day. If you feel that psychological support is something that you'd like to discuss with one of our team members, you can have a look on our website. We've actually got an option on our website where you can complete a form, and one of our team members will be in touch via phone or Skype to have a chat with you. So you fill in the You fill in the request form on our website and our admin team will contact you to arrange that. And that's a little free chat with one of our provisional psychologists to have a little conversation about how you're travelling, whether or not psychology is right for you, what sort of support we can offer, who's on our team and who might suit you best. You can talk to your GP if you're needing psychological support. The GP will, if you're not in our area, of course your GP will know some psychologists or mental health accredited social workers who can support you in your area. But as I've been saying all week long, do jump onto the Beyond Blue website. There's a lot of resources there. Sane Australia, so SANE, Sane Australia is another one that you can have a look at. And of course there's Lifeline as well. Don't forget the Beyond Now app if you are feeling concerned about yourself or even someone that you love, if you're feeling that they're at risk of suicidal thoughts or suicidal actions. The Beyond Now app is a safety planning app. So if you're feeling at risk of suicide, you're feeling like it's not an urgent matter, but it's something that you want to keep a handle on, then that app can help you with safety planning and implementing a safety plan for yourself, so you feel like you know what your plan will be if those thoughts do become a little bit overwhelming, and you know straight away you've got that app on your phone to help you get the support that you need. Okay. Heavy topic. I've tried to keep it light, but I want you all to know that there's lots of support around. As I said yesterday, we're very, very lucky in Australia. There are a lot of support agencies available. So ask a mate if they're okay. Listen to what they say. Encourage them to take action for support-seeking behaviours, and then check in with them again later. And I'll be checking in with all of you again tomorrow. I hope you have a fabulous day today. Thanks a lot for listening. Bye-bye for now.